Welcome to The Explainer. Today, we're going to follow your food on its very first and maybe most incredible leg of its journey through your body. We're starting right from that first bite, all the way to when it hits your belly.
So what really happens after you take that first bite? Let's dive in. It seems so simple, right? But what you've just done is kickstart this super complex process. You've sent your food into a system that is, believe it or not, almost 9 meters long if you stretched it all out.
And that whole system, that's your gastrointestinal tract, or GIT for short. Our story, our food's journey, begins right at the very top, in your mouth, or what's officially called the oral cavity.
Okay, so let's talk about the mouth. You should really think of it like a super efficient processing plant. It's not just an entrance, right? It's where the first absolutely crucial steps of digestion begin. We're talking both mechanical and chemical.
Inside, you've got the teeth, the tongue, the salivary glands. They're all working together. And this is where something called motility gets started. Motility is just a fancy word for the movement of food, and it all kicks off with mastication, or, just plain old chewing.
Now, chewing has 3 main goals, and it's not just about getting food small enough to swallow. First, obviously, you're breaking it into smaller pieces, which increases the surface area. Second, you're mixing it with saliva. And third, you're stimulating your taste buds, which basically sends a heads up to the rest of your digestive system that food is on the way.
Speaking of saliva, it's a huge part of this initial breakdown. And get this, you produce a ton of it. We're talking 1 to 2 liters every single day. That's a lot of liquid, right? So what's it all for?
Well, saliva is like a superhero fluid. It's way more than just water. It lubricates your food so you can swallow it. It has enzymes that start digesting carbohydrates right away. It's got antibacterial properties. It helps you taste things better. And it even neutralizes acids to protect your teeth. It really does a little bit of everything.
And because of all that activity, here's the crucial takeaway. Your mouth is literally a window into your overall health. What's happening in there can be a direct reflection of your nutritional status.
Now that's right, your doctor or your dentist can actually spot clues about your health just by having a look inside your mouth. Little changes can point to much bigger things going on in the rest of your body.
And this is why it really matters for you. Check this out. If your gums are bleeding, that could be a sign of a vitamin C deficiency. Those annoying little cracks you get at the corners of your mouth, that might be a lack of vitamin B2. Pale tissues could mean you're low on iron. See, your mouth is trying to tell you something.
Okay, let's touch on a couple of common problems. First up, one we all know and probably don't love: dental caries. That's just the fancy term for cavities. They happen when acid, usually from bacteria feasting on sugar, starts to eat away at your tooth enamel.
Another big one is gingivitis. This is basically just inflammation of the gums. So if you ever notice they look a little red or swollen, or maybe they bleed when you brush your teeth, yep, that's probably what's going on.
All right, so once you've chewed and swallowed, where does the food go? Well, it doesn't just fall down into your stomach like a rock down a well. It actually travels down this muscular tube, the food chute, if you will, called the esophagus. The esophagus has a pretty straightforward job, but it's absolutely vital. It's the transit tube that actively pushes the food from your throat down into your stomach. It does this using these little waves of muscle contractions.
But, sometimes that simple journey can hit a snag. Think of it like a traffic jam, or maybe a faulty gate at the end of the road. And one of the most common issues here is something called GERD, or gastroesophageal reflux disease. You've probably heard of it as heartburn or acid reflux. It's basically when that little valve between your esophagus and your stomach doesn't close up tight, and stomach acid, well, it goes the wrong way, back up the tube.
So how do you deal with GERD? Well, the treatment is usually a step-by-step approach. You start with the simple stuff, like lifestyle changes, maybe changing up your diet. If that doesn't work, you might move on to medications that reduce stomach acid. And then, only in some of the more serious cases, surgery might be an option.
And another potential problem is something called dysphagia. Now that's the medical term for having difficulty swallowing. And it can be a really serious issue, because if it's hard or even painful to eat, it's going to be really tough to get the nutrition your body needs.
So let's bring it all together. What's the big takeaway here? It's that your mouth and your esophagus aren't just a passive doorway for food. No way. They are actively setting the stage for every single thing that's going to happen next in digestion.
Think about it. A healthy start right here, With good chewing, healthy saliva, and esophagus that's working just right, that ensures your body can do its job efficiently, breaking down and absorbing all those nutrients further down the line. It really is your gut's first and maybe most important impression.
So, what is your body telling you through your mouth? It's really this amazing window into your overall wellness, and it's sending you signals all the time. It's absolutely worth paying attention to. So maybe the next time you look in the mirror, you'll see things a little differently.